Welcome to Pharmacology Outline channel. Today, we'll discuss muscarinic receptors. These are G-protein-coupled receptors activated by acetylcholine, primarily in the parasympathetic nervous system, specifically the 5 known subtypes, M1 through M5. Let's begin by M1 receptors. M1 receptors are predominantly located in the central nervous system, particularly in the cerebral cortex, hippocampus, and striatum. They're also found in the gastric parietal cells. Signal transduction is GQ. It activates phospholipase C, increases inositol triphosphate, and diacylglycerol that raises intracellular calcium. Physiological effects: enhances cognitive function, facilitates neuronal excitability, and stimulates gastric acid secretion. Clinical note: antagonism at M1 receptors can cause cognitive impairment, which is relevant in elderly patients or those with dementia. M2 receptors. M2 receptors are found primarily in the heart, especially in the SA and AV nodes, and to some extent in the atrial myocardium. Signal transduction is GI second messenger pathway, inhibits adenylate cyclase, decreases cyclic AMP, activates potassium channels. Physiological effects: slows heart rate, negative chronotropy, decreases conduction velocity, negative dromotropy, and slightly reduces contractility. This is the receptor primarily responsible for the bradycardic effects of acetylcholine. M3 receptors. M3 receptors are widely distributed in smooth muscle, glands, and the eye. Signal transduction is GQ second messenger pathway. Like M1, it activates phospholipase C and increases intracellular calcium. Physiological effects: smooth muscle contraction, for example, bronchoconstriction, bladder contraction, increased GI motility. Glandular secretion, salivary, lacrimal, and sweat glands. Meiosis and accommodation via contraction of the sphincter and ciliary muscles of the eye. Therapeutic relevance: M3 antagonists, like ipratropium and tiotropium, are used in COPD and asthma to induce bronchodilation. M4 receptors are located in striatum and other CNS regions. Signal transduction is GI function, likely involved in modulation of dopaminergic transmission and locomotor activity. M5 location: substantia nigra, basal ganglia, and cerebral vasculature. Signal transduction is GQ function, may regulate cerebral blood flow and support dopaminergic signaling. So, to conclude, M1, M3, and M5 are all coupled to GQ proteins, leading to increased intracellular calcium via phospholipase C activation. M2 and M4 are coupled to GI proteins, which inhibit adenylate cyclase, resulting in decreased cyclic AMP levels. This table summarizes the receptors, their signal transduction pathways, cellular locations, and functions. Thank you for watching. If you enjoyed the video, please like and subscribe for more pharmacology insights. Hit the bell to stay updated. Keep learning.